Hamstring has a lot of tendons in its muscle structure. All right, which one now? This one, right? Okay. Lie down. Okay. So it is important to put the hamstrings under stretch. Okay. Um, Now that's very difficult for me to hold this like this, because the moment I leave, this comes crashing down. If she was able to hold. Oh, no. Okay. Wait. Anybody got a towel or anything? Towel. Oh, got something? Okay.
It's my last one.
For the time being. Later, whatever you will say, I know nothing about this. This one on the face. No, this one on the chest. This one on the chest. Next time, we must try. You have a hamstring injury? Okay. She has a hamstring injury. Let's ask her, where does it hurt? Lower 1/3 or upper 1/3? Upper 1/3, which is the most common thing, much closer to the ischial tuberosity. All right. So if we have to ask her if she has a point of maximum tenderness, just let us know where is that. I'm deliberately on the lateral side because biceps femoris is most commonly affected, but may not be the case in her situation. Somewhere around there? Okay. Somewhere around here. Okay. So we will follow. How old is this injury? 2 weeks. So it's not acute. If this was 2 days old, what I should have done is taken one eye strip and stuck like this and asked her to go. But this is subacute. So we will now use one I and one Y. Okay? To save time, we'll cut both these together. Okay, now watch. The same concept, guys. I have deliberately selected those techniques where there is a overlap of concepts. If around this is her point of maximum tenderness, what we will now do is, the tissue is under stretch. Okay?
You need to round the sides of the tape.
Sorry?
You need to cut round the sides.
Yes, you should always do that. It is just to save time that we are not doing it, but always cut the tape edges, ends in a rounded manner. So we will stick this just below the point of maximum tenderness. All right. That's a bit long for her size. We will shorten it a little bit. Some more. Okay. Now, feel this. Keep in mind the point of maximum tenderness, just with a gentle stretch, not so much. Okay, what is gentle? 100%, 80, 50. Good enough. Stick around the point of maximum tenderness. At the end, leave all tension and just stick it like that. We've been doing the same thing for everything. So the basic concept is just the same. But prior to that, understanding the location of injury, the mechanism, the point of maximum tenderness, this is what drives a good kinesiotape application. All right. Again the same thing. Lock here. 100, 50, around the point of maximum tenderness. Okay. Many a times, if the injury is not severe, this is good enough. Okay. But if the injury is severe, there's a lot of pain and stiffness and discomfort and functional limitation. You might choose to apply another one. Okay.
One question: does the tape have to like connect?
No, not at all.
Okay.
Not at all. You can have these two arms going like that also. It's perfectly okay. No problems. Okay. So the second reinforcement of what you have done is this. All right. Now remember this. We discussed that if it's a medial bicep, you must push that to the midline. If it's a lateral biceps, also push that to the midline. Okay? In her case, this is somewhere the point of injury, which is more about the lateral biceps. Usually that happens. Usually it's biceps femoris. So what we'll do here now is we'll stick this at this point, just in line with where her point of maximum tenderness is all is there. Then what we'll do is we will free the arm. Almost done. Almost done. The poor thing is having to hold it. Okay. Now remember, usually the horizontal strips are strips with greater degree of stress, whether it's tennis elbow, whether it's shin splints, whether it's hamstring. Okay. So now what we'll do is we will gather this and pull the whole thing towards the midline. Pull the whole thing towards the midline. Support here and pull the whole thing towards the midline. And once you pull it, lock this part. Lock this part with 100%, 80%. Stick. And as you reach up, free it all of all the tension. Similarly, the second one as well. Grip, grip, midline shift. Grip, midline shift. Grip, midline shift. 100%, 80%. Lock and gently rotate up. Okay, this provides that extra bit of reinforcement to the hamstrings. Okay.